First, I just wanted to say thanks, Elizabeth, for the invite and allowing for me to come on and talk about what we're doing at the School District of Philadelphia in connecting health and attendance. So I am a pediatrician and I'm also the medical officer for the School District of Philadelphia. And what that entails is I lead our Office of Student Health Services. And we are really focused on kind of the physical health side of student health, and then also some integrative behavioral health services through our partners as well. At our school district, we have 275 school nurses. So we have
Wow.
a school nurse in every single school. And we know that that is a intervention, right, for attendance for students, having a school nurse. So very, very proud of that. A big piece of it is accessibility as well of the messaging, like at baseline. So making sure that Philadelphia is extremely diverse. We have 10 languages, including English, that we translate all of our messaging into. So making sure that that messaging is translated and it's written at a grade level that is appropriate and also accessible as well. I think one of the biggest things that we do to ensure that our messaging is clear, we work very closely with our communications team. And so we have been moving towards less text and really pushing towards the use of more infographics as well. In addition to that, making sure that the messaging is received. Getting feedback. So student feedback has been very important in regards to some of our health messaging, multiple rounds of student feedback for the health messaging. And in addition to that, reiterating the messaging over and over. I think that the connection between health, a student's health, and their ability to attend school, and then also their academic performance, it is something that seems intuitive, but it's not really, right? Then you start digging deeper and looking at things like menstrual health equity. So access to menstrual products for students that menstruate. Those are barriers to attendance. And we have seen that in some of our focus groups as well. Health things come up as barriers to attendance. Mental health is a
Yeah.
big one as well. Also a barrier to attendance too. We're using our traditional ways of reaching families and students. So email is a big one as well, making sure that that email is concise and then also this translated into multiple languages. Our parent portal is another avenue that we use. We also do text messaging and robocalls. We have seen, especially over the summer, because we do a lot of communication to our families over the summer around immunizations, just back to school, preparing for back to school. So going to see your doctor, getting your immunizations, getting prepared for your sports physicals. And those text messages and robocalls, again, at a specific cadence, not just once, but over time, are pretty effective in getting parents the information to parents in a way that they can, digest, and also them knowing that this is something that's critical. For the past 2 years, they've been doing canvassing with some of our assets, so the flyers that we have
Oh,
around,
great.
yeah, around vaccination requirements. So they go out, they do things like door to door. They also go to events and they're passing out the School District of Philadelphia information on school immunizations and sports physicals and just, the regular back to school physicals,
Yeah.
dental as well. Yeah, I would say that When you have your messaging, right, you also need to provide resources, accessible resources so that families can actually implement that call to action.